Okay, well, hello everybody. My name is Cliff Dominy. I'm a former laboratory scientist who's now writing for a living. I'm really pleased to be here. It's been a while since we last chatted, so I'm looking forward to this. The topic today is what is personalized medicine? And recently, medical research has pivoted away from traditional large clinical trials and they're investigating designer drugs that will be targeted to a specific individual rather than a broad population. So personalized medicine, as the slide says there, is a custom designed drug made just for you. It may work in someone else, it may not, but it will likely work for you because it's been tailor-made just for your body. And the way they do this is they use a patient's genetics, their DNA and information in their DNA, to design the drug to treat whatever the problem might be. So the traditional way of getting a drug approved would be with a controlled clinical trial. And there are various pros and cons to clinical trials. By definition, they're conducted in a large population of people. So, and the point of conducting an unknown trial, a drug in a clinical trial, an unknown drug, is to see whether it works. First of all, you've got a headache. Does this pill work in clearing up your headache? And also, is it safe? You can't just put chemicals into your body or into a patient's body, and unless you know that it's not going to harm them in some way. So those are the two key elements of traditional clinical trials. So is it safe and is it effective? And the way a clinical trial is run is you typically have doctors will recruit people with a particular condition. Let's say it's a headache, to keep it nice and easy. And they will give the patient a pill and say, yep, take this twice a day for a week and let us know how your headache, if it improves. Well, fantastic. But some people, just because they've taken a pill, could be a sugar pill, will feel that their headache has improved. And other people's headaches will just naturally get better over a day or two after they've started taking a pill. So how do you know it's the pill that's working and not some other factor in the person's life? So to do that, the clinical trial has an intervention arm where people, that's the name of the group of people that are taking the test drug that they are wanting to examine. And then another group of people will be literally taking a sugar pill. So it's going to not do anything in their bodies, but they're going to think that they're taking a pill. So people are randomized here. Often the big trials costing millions of dollars, tens of millions, will have thousands of people in them. And they become very expensive and they don't always work for everybody. So some people taking the drug will just naturally get better, and others taking the sugar pill will just get better. How do you know it's the drug? And so what you need to do is get a lot of statistics and analyze thousands of people taking the drug to see whether it is statistically likely that the drug is the reason their headaches improved. So you can see that's rather inefficient. That's a lot of work and resources and years of following people to arrive at that decision. Now, personalized medicine is attempting to move away from this. Now, it's not going to be for things like headaches, but for more serious conditions like cancer and the like. So how do you know if someone's taking that drug, whether it's the drug working? How do you know it's going to help people? How do you know it's not going to harm some people? The reason being is we're all not clones of each other. This is not Star Wars. Each human body is uniquely different to any other human body. Even identical twins, whilst they share the same DNA, are going to have marked differences in how that DNA is regulated, and all the proteins and enzymes that the DNA produces will vary even in identical twins. So here we have a guy, a cartoon of a guy or a woman, and they're made up of thousands of cells. Each cell, as you can see, has 23 pairs of chromosomes in humans. They contain upwards of 32,000 genes that all do something. There's also vast areas of DNA in your chromosomes that don't code for anything that we know of yet. So there's a lot of stuff going on, and they all vary from human being to human being. All told, you have 3 billion pairs of DNA in your body. So whether you respond well to a drug or poorly to a drug often depends on your DNA. So if doctors can examine your specific DNA, they can design a drug that will hopefully you will respond well to, get all the benefits from, without any of the side effects. So today I would like to cover 3 techniques. There are a number of others as well, and more are being designed and invented every day. But these are the 3 kind of pioneering techniques that really launched personalized medicine into the doctor's office, as it were. So the first technique is called CRISPR. CRISPR, and you do not need to remember this, but it stands for a clustered regularly interspaced short palindromic repeat. But everybody calls it CRISPR, fortunately. And it was discovered by 2 scientists, Jennifer Doudna in the USA, and her colleague Emmanuel Charpentier in Paris. And they were awarded the 2020 Nobel Prize in Medicine for developing this gene editing system. Now, what is CRISPR? Well, you must think of it as a pair of genetic scissors. You've got 3 billion base pairs of DNA in your body, in each cell of your body. And they all vary between you and your family and your friends and everyone else. And but what if you have a mutation in your DNA that is causing you some harm, or it's causing you to respond poorly to a drug? Well, CRISPR can be used to edit that DNA, to change it from the bad base pair that's causing the problem to a good base pair that can hopefully allow the drug to do its job. So it's a gene editing system where it's just like you would cut and paste text in a document. You can move mutated DNA out of a genome and bring in healthy nucleic acids, healthy DNA, to replace it and hopefully solve the problem. So it can fix genetic mistakes that might be causing either a disease or a bad outcome to a drug. You can fix that in the human being. So if all those DNA, all those 32,000 genes and 3 gigabases of nucleic acid or base pairs in your DNA was a recipe book, and one of the recipes in that recipe book, so your whole genome's the recipe book, One recipe says add a cup of salt to whatever the recipe might be, whereas the correct instruction was add a teaspoon of salt. There's a big difference there. CRISPR can now come in, change cup to teaspoon, and your body will then be producing a far more pleasant recipe that you when you eat it. So a cup of salt, teaspoon of salt, big difference. CRISPR can go in and just change that one thing and fix it. So how has CRISPR been used? Well, already it's been used in diseases like sickle cell anemia. So sickle cell anemia is the red blood cells in your blood have a very important task of carrying oxygen around the body, and in some people they have a genetic mutation in their hemoglobin gene, which is literally the molecule that gives the red blood cell its red color, and that's the oxygen carrying protein called hemoglobin. If they have a mutation in the gene that codes for hemoglobin, they won't be able to carry as much oxygen around the body. So they have created a CRISPR gene editing system in those people that can go in, they inject it into the body, and every blood cell that has the mutated hemoglobin mutation in it, it gets in there and it flips it back to a healthy hemoglobin. So as you can see, it's called sickle cell anemia in the picture because the hemoglobin doesn't form that nice sort of lozenge-shaped structure. It is mutated and changed to form a sickle there, which indicates that the person has the mutation and the disease. So Casgevy is the name of the gene therapy. It's used. It's designed specifically. They find out exactly the mutation of the person that is suffering from the sickle cell anemia. Casgevy drug will go in there, infused into the bloodstream, switch it back to healthy hemoglobin or red blood cells, and the patients get a lot of energy back. They're getting oxygen delivered to their bodies. They don't feel sick all the time, and essentially they have been cured. Not everybody, of course, but 97% of patients are still feeling healthy and not suffering from the anemia a year after receiving just the one-time gene therapy shot. And 5 years later, the 5-year follow-up of that particular trial showed that they were healthy. So a great example of CRISPR gene editing fixing a serious problem in people with sickle cell anemia. Does anyone have any questions? Because please feel free to jump in if you have any questions. All right. Okay, so the second technique, CAR T therapy. Now that sounds complicated, and to a degree it is, but it's a way of educating your immune system to spot cancers that are likely being ignored by the immune system and being allowed to grow. So your immune system, think of it as a guard outside a castle or at a castle gate. And he's been trained to spot bad guys. So if you're a bacterium, your immune system is the guard. If a bacterium comes along, and I can see in the cartoon there, that guy has a light bulb on his head. He kind of sticks out. It's easy for the guard to see that guy, the bacterium, and say, no, you're not allowed into the body. And he goes and throws it in the dungeon, and the bacterium can't get into the castle, which is your body, and cause disease. Now, things get a little trickier if you're talking about viruses. Many viruses also come with light bulbs on their heads, metaphorically speaking, and can be stopped. But some of them are not recognized by the guard. And you can see in that left-hand shot, there's a guy sneaking behind the guard and getting into the castle. So that is potentially a virus like the SARS-CoV-2 virus that caused the COVID-19 pandemic a few years ago. They have a way of getting past the immune system and into your body, into the castle, where they can start causing problems. So how do you educate the guard that to recognize more and more types of light bulbs on people's heads and allow fewer and fewer to get past it? Now, I should add now, of course, in the case of cancer, cancer is in fact your body, or an older person's body in most cases, that has a mutation that causes a tumor to grow in the body. The guard isn't going to see any of those guys because the guard has been trained that no, that sort of cell is a friendly body human cell. You just let it do its thing, and that's how tumors can grow. So CAR T therapy takes that guard back to school and say, no, this is what you need to look for in a cancer tumor, and then treat it like a bad guy. Attack it, get rid of it, throw it in jail, kill it, make it go away, because cancer is clearly bad news. So what doctors can do is they will take your blood from your body, and they will look at your T cells. That T cells are part of the immune system that float around in your blood and are very important. And they will grow those cells in a petri dish in the laboratory, and they will reprogram them. They will look at the type of tumor that the cancer patient might have, and they will reprogram them to recognize that that tumor cell not as a friend, but as an enemy. And the way they do that is they take a little bit of the tumor DNA that is different, it's mutated, it's different to healthy DNA, and they show it to the T cell and say, here's the bad guy. This is his light bulb. Go after him and kill him. Seek and destroy. So and then they will take those cells that have now been educated in a petri dish in the laboratory, and they will infuse it back into the patient who still has the tumor growing. But the new cells will go, oh, he's bad news. They will attack it and destroy it. So this is very successfully used in what is known as the blood-borne cancers, either the lymphomas or leukemias, which are they're essentially cancers in different cells in the blood. And the doctors are having a lot of success treating those diseases with this particular therapy. It does have side effects. Sometimes the guard gets a little bit too carried away and starts attacking other parts of the body. So CAR T therapy has now, people are moving away from T cells, which is what the T stands for in CAR T. They're moving away to other types of immune cells, but the difference is that they will likely not have as many side effects as T cells. So the latest one is called the natural killer cells, which is an awesome name, gives you an idea of what its job is. So if they can design CAR NK cells to attack cancers, that likely will reduce the side effects of the treatment. So yeah, so I guess if your body is a video game, and so if your body's a video game and cancer is the boss level, he's the worst guy in the whole game, and your immune cells are the players within the game, and they don't recognize the boss, that's a problem. CAR T therapy gives them the cheat codes so that they can recognize the boss and defeat them. I saw your question, side effects. So side effects are things when a drug is in the body, it's got a target, it's got a job to do, sort out the headache, kill the tumor cell. A side effect is something that you don't want. It's something that maybe you start feeling nauseous with the treatment, or in the case of the tumor therapy, maybe you get really bad stomach illness. It's something that you would rather not have. In an ideal world, you want the drug to do just its job and not affect anything else. So it's kind of the bad things that drugs might have.
What are some of the challenges of CAR T therapy? Is it effective and efficient, or not really?
It is very efficient in treating blood-borne cancers like the lymphomas and leukemias. Let's just move on. Here we go. So it's early days, of course. This is cutting-edge stuff. This is not standard of care, certainly at the moment. But some trials that I'm going to talk about now have shown great improvement and will likely become standard of care, which means what the doctor will go to first for treating these blood cancers. So Yescarta, that's the name. They've got some crazy names for these new drugs, by the way. So Yescarta is the name of a new drug. It showed an 82% improvement in leukemia treatment, and it completely cured 54% of people with that disease. That's a serious disease. So Yescarta is going to save over half the people who have been diagnosed with the disease, and 82% are going to live much, much longer. So again, doesn't work for absolutely everybody, but it's a huge improvement over what is currently available. Carvykti is a different drug. It's aimed at lymphomas, and that's 97%. Who named it CAR T? Okay. Well, it's actually an acronym. It stands for Chimeric Antigen Receptor T-cell Therapy. So, yeah, it's basically it's teaching the receptors, is teaching the body as to exactly what the tumor looks like, and it's using a T-cell to get the job done. Chimeric just simply means it's a fused genetically modified product, and the antigen is the tumor that you want recognized and destroyed. So great question, but yeah, so like CRISPR, it has a long acronym that is not critical to understanding how it works. Okay, so CAR T therapy, just to upgrade, it's like giving your immune system a superhero upgrade. Doctors will take the T cells in white cells. It could be a macrophage or a natural killer cell, but generally it's a T cell, and reprogram them to destroy the tumor, and then put them back in your body and let them get to work doing their job. Right. The third and last thing I want to cover is organoids. And organoids are have only really recently been developed. And an organoid is basically an organ from a person's body, or organ cells taken from a person's body and grown in a petri dish. But this isn't any petri dish. Usually when you take cells from a human being and grow them in a petri dish, which CAR T does, and CRISPR and all that stuff, they're cells loose, sloshing around in liquid. An organoid is actually an attempt to rebuild the organ in a petri dish. And so it's a three-dimensional growth in a rather deep petri dish, because they, of course, can grow, up to the size of a pea at least. Now, these are not, if someone takes a heart cell from your heart, or a blood cell from your blood, and but let's use the heart example. They take a heart biopsy, take a little bit of tissue. They cannot regrow your heart in a petri dish. There's no blood vessels in that thing. But they can grow heart muscle tissue in the petri dish and see how it responds to drugs before it even goes into your body. They can also look at the mutations in the heart muscle and design therapies to address it. They can then, well, I'll get onto some examples in a moment, but where this really comes into its own is when they discovered how to make stem cells. Stem cells have been very controversial. They found in developing embryos, which makes them an ethical problem. And they have now found a way how to take your adult stem cells, so your blood cells that are in your blood at the moment, and they found a way how to convert them back into a stem cell that you would find in a baby, or in a fetus, actually, not a baby, a developing fetus. So you now no longer, if you want to do this research, you no longer need to use human embryos to do the research. So everyone is far happier that, because just donating some blood from your arm isn't a big deal, but using a human embryo is ethically troublesome. So they can now take that blood from your arm, turn it back into a stem cell like you had when you were developing, and then they can convert it into a different type of cell. So it was once upon a time a blood cell, now it can become a liver cell, or a bone cell, or a brain cell, or you get the idea. And then they can take that new cell and build an organoid with it. So now they've got your cell taken from your body, and they've turned it into the undifferentiated stem cell. You can see there's a pacifier in that one little cell over there. And then they've grown it up into a new organoid, not the actual organ. But this is very useful because they can now start curing things like degenerative bone problems. They can build healthy new bones and put them back into your body. People with type 1 diabetes have defective cells in their pancreas that can no longer produce insulin. They can potentially, they haven't done this yet, but they can potentially produce healthy pancreatic cells that will start producing insulin, in which case you will cure type 1 diabetes. It's very early days, but it's interesting, and I wanted to mention it because although there aren't any huge success stories as yet, it is very promising for trials in the future. You could use it, as I said there, you could use it to, if you have a bad wound or bone cartilage or bone tissue that needs repairing, you can create these cells from your own blood cells, turn them into skin cells and repair wounds, or pancreatic cells and cure type 1 diabetes. Not yet ready for humans, though. They're still doing a lot of mouse research, as you can see from the cartoon there. But the important thing is no more human embryos are needed now for this sort of research, which makes everyone feel good. And possibly down the road, they may not even need animals like mice for laboratory testing. So that's good news if you're a mouse. And right, yeah, so essentially that is really the cutting edge. No Nobel Prizes here yet because it's far too soon, but with any luck, it will be a successful venture for a lot of this sort of regenerative body parts in the future. All right. So, to conclude, complex diseases may require complex solutions.